On my rotations, because I'm trying to decide what it is that I'd like to do with the rest of my life, and I'm critically evaluating where I want to take my career, in addition to learning as much as I can from my preceptors about every specialty that I'm practicing in, I'm also critically evaluating the specialty and what the pros and cons of it are. I think on a rotation like psychiatry, where there are really high highs and really low lows, it really accentuates to me, like, is this something that I can do? Because I have to be willing to accept that for the rest of my life, I'll be experiencing the best of the best in this practice, and then I'll also have to be accepting the lowest of the lows as far as what it can give to me. Another important point is sometimes a specialty will have really high highs and really low lows like that, but there's just like a middle ground where everything is like the bread and butter of that's what you're actually doing every day, as compared to getting those really high payoff moments or those really rough, disappointing moments. I think about this a lot with psychiatry because there are some moments where, like, you can treat a patient and you can literally see them before your eyes respond to the medication, and suddenly, like, they go from having these delusions, these hallucinations, and then they're talking to you like normal right after. On the flip side of that, there are really frustrating low lows, because today we were dealing with a patient that has issues with substance abuse, and I was asking my preceptor, like, do you think that they're serious when they're saying that they want to get better and they want to do better, or are they just saying that so that they can kind of get out of here and get what they want? And to me, he's like, actually, I wholeheartedly believe them that they want to do better. Like, I nobody wants to live like that. Then he prefaced with saying, like, this is going to sound really jaded, but how many patients do you think actually recover from substance abuse? And from that response, I already knew, and I said 0, and he goes, yeah, I can say with confidence that over my 10 years of practice, I have not had a single patient that I have personally been able to help and successfully kick aside their substance abuse. But he did qualify that, and he said, it's not that it never happens, it's that me as a psychiatrist I can never claim to have actually done that successfully. He says that during his practice, there have been 2 patients that have successfully kicked their substance abuse, and neither of them he can take credit for, because both of them had external things in their life that they chose to get better from and for. I'm just articulating this because when I'm thinking about, like, what do I want to do for the rest of my life, I have to evaluate what's the best of the best moments that I'm going to get out of this, and what are the worst moments that I'm going to have to deal with on a regular basis. And then what's the bread and butter? What is it going to be like that I have to deal with and see every single day and just consistently be okay with? Perhaps maybe I'm looking for something where that bread and butter, that thing that I'm doing every day that would normally be monotonous so that I have to get used to, maybe I can like that. Or maybe I can just be okay with the fact that I do that, and then find something where the highs are really, really worth that payoff and I can tolerate those lows.